The emergency room was already bleeding out before she walked through the door. 37 patients, 4 doctors, 2 nurses down with a stomach virus that had swept through the overnight staff like a brush fire. At Harlow General Hospital in Denton, Missouri, Tuesday nights were supposed to be slow. Instead, the triage board looked like a car accident had mated with a train derailment and produced something worse. A code blue in Bay 6. A chest lac in Bay 2 still waiting on a second set of hands. And in the ambulance bay, the radio was already crackling with something nobody wanted to hear. Multiple casualties inbound, nature unknown, ETA 11 minutes. That was the moment Nora Voss walked in for her shift. She was carrying a canvas bag, a half-finished cup of gas station coffee, and the particular kind of stillness that made people assume she had nothing interesting going on inside her head. 28 years old, medium height, brown hair pulled back in a clip that had seen better days. She had been working at Harlow General for 9 weeks, and in those 9 weeks she had been assigned to med-surg overflow, supply restocking, and twice to the pediatric waiting room to read stories to kids whose parents were tied up in triage. Nobody had asked her about her background. Nobody had thought to. If you've been watching from the beginning, thank you. If this is your first time here, stay until the end, because this story goes somewhere you won't expect. Hit like, subscribe, and drop a comment with your city and country. I want to see how far this story travels. The charge nurse that night was a woman named Deborah Finch, 51 years old, 22 years in emergency medicine, with the kind of voice that could cut glass when she needed it to. She was good at her job. She was also exhausted and working her 4th double in 8 days, which meant her patients had been filed down to approximately nothing. "Voss," she said, not looking up from the board when Nora checked in. "You're on supply runs tonight. Bay storage is low on chest tube kits, and we're out of trauma dressing size 4. Handle that before anything else." "Already noted it when I came through," Nora said. "I can pull from the secondary supply room on 3 if main is tapped." Deborah finally looked at her. It was the kind of look that meant she was reassessing something without wanting to admit it. "Fine. Do that. Then come back here." Nora nodded and went. She had learned very early that the way to survive a new environment was not to push, not to perform, and absolutely not to make yourself the most interesting person in the room. You showed up. You did the thing that needed doing. You kept your eyes open and your mouth mostly shut. It was a skill she'd developed in places considerably less forgiving than a Missouri emergency room, but the principle transferred cleanly. She was loading a cart on the 3rd floor supply room when she heard the overhead speaker crackle. "Trauma activation, Bay 1 through 4. All available personnel to the emergency department. Multiple incoming casualties. Military origin. Classified status. ETA 4 minutes." She stopped loading. "Military origin. Classified status." She put the cart back and walked to the elevator. Dr. Roland Pryce was the kind of surgeon who had confused confidence with competence so early in his career that the two had fused together into something genuinely difficult to distinguish from the outside. He was 44, department chief of emergency surgery at Harlow General, with a wall of credentials and a habit of talking over people mid-sentence that he had never once been asked to examine. His residents called him Pryce Master behind his back, not as a compliment. He was the one who had decided, in Nora's 3rd week, that she didn't belong on the trauma floor. It had started over a patient, a 40-year-old man brought in after a construction accident, femur fracture, significant blood loss. Nora had been in the bay when he arrived and had already started a pressure assessment and called for a type and cross when Pryce walked in and looked at her like she was a piece of furniture that had wandered into the wrong room. "Who authorized you to initiate on this patient?" he asked. "He was losing pressure," Nora said. You're a floor nurse. This is a trauma bay. You don't initiate anything in here without authorization." He turned away from her before she finished the sentence. "Somebody get me a real nurse." The resident standing next to Nora, a second-year named Marcus Webb, had the decency to look uncomfortable. He didn't say anything, but he looked uncomfortable, which Nora noted and filed away. After that, Pryce had made it his informal policy to redirect Nora whenever she appeared near a trauma bay. He wasn't dramatic about it. He didn't make speeches. He just consistently, quietly, ensured that she remained on the periphery of anything that mattered. Supply runs, intake paperwork, vitals monitoring on stable patients. It was the kind of professional erasure that didn't leave fingerprints. Nora let him do it. She showed up. She did her work. She waited. What she was waiting for, she couldn't have told you exactly, but she had learned that the right moment had a way of arriving whether you planned for it or not. The military helicopters came in two. The first landed in the parking structure's upper deck, which had been cleared in a controlled emergency protocol that Harlow General had apparently rehearsed but never actually executed. The second set down in the ambulance bay so fast that two of the paramedics on shift had to back their rigs up to make room. And even then, the rotor wash took a coffee cup off the hood of a police cruiser parked 50 yards away. Nora was coming down the stairwell when she heard the rotors and felt the pressure change in the air, the kind of low thrum that you felt in your sternum before you consciously registered the sound. She had felt it hundreds of times. Her body knew it before her brain named it. She pushed through the stairwell door onto the ground floor and joined the stream of staff moving toward the ambulance bay. The first patient came through on a litter, a soldier, mid-30s, in tactical gear that had been partially cut away. Significant trauma to the left shoulder and upper chest, field dressings already in place, multiple IVs running. He was conscious. Barely. His eyes were moving, tracking faces, and his lips were moving around words that weren't quite making it out. The second patient was worse. Unconscious. Head wound, heavily bandaged, blood pressure numbers being called out by the medic escorting him that made 3 of the nurses in the bay go very still. The third, and this was the one that changed everything, was a young soldier, couldn't have been more than 23, with a penetrating chest injury that the field team had managed with a chest seal, but which was showing signs of tension developing. His oxygen sat was dropping in real time. The medic calling his numbers looked controlled, but his eyes were doing something else. Pryce swept in like he owned the air in the room, which, to be fair, tonight he more or less did. He pointed. He barked. He organized the trauma team around the first 2 patients with the efficiency of a man who was very good at command performance. He was directing residents, calling for imaging, running the room. And the third patient, the young soldier with the developing tension pneumothorax, ended up in Bay 4 with a first-year resident named Asha Karim, who had been out of medical school for 14 months and who was doing her best, which under ordinary circumstances would have been adequate. These were not ordinary circumstances. Nora was in the hallway when she saw Asha's face through the bay window. She knew that face. She had worn that face herself once, in a different country, in a different kind of room, when she had been 22 years old and had been handed a situation 2 sizes too big for her training and had had to decide in approximately 4 seconds whether to freeze or move. She moved now. She pushed through the bay door and looked at the patient, then at the monitor, then at the chest seal, and the whole picture assembled itself in her head in about the time it takes to exhale. "He's got tension developing on the left side," she said. "The seal's not venting properly. We need to decompress." Asha looked at her. I was going to call... No time. His trachea is going to shift if we wait. You have a 14 gauge anywhere on this cart? Asha opened a drawer. Her hands were shaking, but she found the needle. "Second intercostal space, mid-clavicular line," Nora said. "You know the landmark?" "Yes. Yes, I know it." "Then do it, right now. I'll hold him." Asha did it. She was not graceful about it. Her first pass found the correct position, and she drove the needle home, and there was a very specific sound, a hiss, controlled and immediate, that told Nora what she needed to know. The pressure was releasing. The monitor's alarm shifted tone. The patient's oxygen sat started climbing back. Asha let out a breath that sounded like she'd been holding it for a week. "Oh, God." "Keep watching his breath sounds," Nora said, "and get me a chest tube tray. This is temporary." She was already at the supply cart when Pryce came through the door. He took in the scene in about 2 seconds. The needle in the patient's chest. Nora at the cart. Asha standing there with her gloves still on. "What is happening in here?" he said. It wasn't a question. "Tension pneumo," Nora said without turning around. "Dr. Karim decompressed. It worked. He needs a chest tube." "You..." Pryce stopped. Started again. "You authorized a needle decompression on a military patient without attending supervision?" "She didn't authorize it," Asha said carefully. "She walked me through it. I performed the procedure." "You're a first-year resident. She's a... What are you exactly?" He was looking at Nora now with something that had moved past professional irritation into something harder. You're a floor nurse. Who put you in a trauma bay? Who told you? His SATs were at 78, Nora said. She turned around now. They're at 94. I'm going to recommend a chest tube next. Pryce's jaw did something complicated. Get out of this bay, right now, and report to Deborah Finch. You're going to explain to her exactly what you did in here, and then the two of you are going to explain it to me. After the chest tube, Nora said. Now, Voss. She looked at the patient. She looked at the monitor. The numbers were holding. Asha could manage the chest tube with supervision from a senior resident. It wasn't ideal, but it was manageable. She looked at Pryce. I'll be in the hallway. She left. But she didn't go to Deborah Finch. She stood in the corridor where she could see through the bay window, watching, until she was satisfied that Asha had the situation controlled. Then she stepped back and stood against the wall and let the noise of the department move around her. Marcus Webb, the second-year resident who had looked uncomfortable weeks ago, appeared beside her. That was the right call, he said quietly. I know, she said. He's going to make your life difficult. I know that too. Marcus looked at her for a moment. Who are you? Nora looked back at the bay window. Somebody who knew what attention pneumo looks like. Pryce made his life difficult in exactly the ways she expected. The next morning, there was a meeting with Deborah Finch and the hospital's nurse manager, a careful woman named Sylvia Okafor, who had been navigating institutional politics for 30 years, and who had a gift for translating conflict into bureaucratic language that hurt everyone involved slightly less than it might have otherwise. The charge against Nora was not dramatic. It was specifically, carefully constructed to be as boring and procedural as possible. Unauthorized clinical intervention in a trauma environment, failure to follow chain-of-command protocols, performance of clinical assessment outside the defined scope of a floor nurse. None of it was technically wrong. I understand the concern, Nora said when Sylvia finished laying it out. Do you have anything to add? Sylvia asked. The patient's alive. His numbers were in free fall when I walked in. That's not, Pryce started. I know it's not the point of this meeting, Nora said. I'm just noting it for the record. Sylvia wrote something down. Her face gave nothing away. The outcome was this. Nora was removed from emergency department rotation until a formal review was completed. She was reassigned to the medical surgical floor on the east wing, third floor, stable patients. Nothing that moved too fast. She was handed the reassignment letter in a manila envelope that still smelled like the copy machine. She took it. She thanked Sylvia. She left. In the elevator, alone, she unfolded the letter and read it twice. Not because she didn't understand it the first time, because she wanted to be sure she felt exactly what she actually felt, rather than what she thought she was supposed to feel. What she felt was something close to tired. Not defeated, tired. There was a difference that mattered. She had been dismissed before. In more consequential places, by people with considerably more authority than Roland Pryce and his institutional grievance. She had learned, in those places, that the thing you did with being dismissed was, you went somewhere quiet, you did not perform your feelings for an audience, and you waited for the ground to shift. The ground always shifted. 3 weeks passed. Nora worked the third floor. She took vitals. She adjusted medication schedules. She sat with patients who were scared and needed someone to talk to, which she turned out to be unexpectedly good at. Not because she was warm in any obvious way, but because she listened without manufacturing a response, and people could feel the difference. A 67-year-old retired teacher named Bernard told her, on her 9th day on the floor, that she had a very calming face. Like someone who's seen a lot of things and isn't frightened anymore, he said. I've seen some things, she agreed. Military? She looked at him. What makes you ask that? The way you move, he said simply. My son was Marines. You move like him, careful, like you're always checking the room. She didn't confirm or deny it. She adjusted his IV and told him his daughter would be up in an hour and that the cafeteria made a decent beef barley soup on Tuesdays. On the 14th day, she got a call from Marcus Webb. She took it in the stairwell because the third-floor hallways were never actually empty and she had learned to make use of vertical space. I don't know if this is my place, Marcus said, with the careful tone of someone who had rehearsed the sentence. But I thought you should know. Pryce is writing up the formal review, and there's a notation in the patient record from that night. The soldier, the one with the chest injury. What kind of notation? The the kind that attributes the initial intervention to a spontaneous protocol deviation by an unauthorized staff member that required correction by the attending physician. A pause. He's documenting it like he came in and fixed something you broke. Nora was quiet for 3 seconds. Is that what the resident is saying? Asha? No. But Asha is a first year and Pryce is her direct supervisor for the next 6 months of her residency. Nora absorbed this. Okay, she said. That's all you've got? Okay? What would you like me to say, Marcus? I don't know. Something that sounds like you're going to fight it. I'm going to let it proceed, she said. The review. Whatever he's written in the chart. Nora. The record can say whatever he needs it to say. The patient went home. That's the part that doesn't change regardless of what's in the chart. Marcus was quiet. Then, I don't understand you. That's fine, she said. Thank you for calling. She hung up and stood in the stairwell for another minute, listening to the building breathe around her. The hum of ventilation, the distant clatter of a meal cart, the automated voice of the overhead pager moving through its rotation. Then she went back to the 3rd floor and finished her shift. The call came on a Wednesday. Not a phone call, not an overhead page. A physical interruption to the ordinary motion of the day. A hospital administrator named Crawford appearing on the 3rd floor with the particular expression of someone carrying information that is slightly too large for the container they're walking it in. Voss, he said, spotting her at the nurse's station. There's a situation in the emergency department. Dr. Okafor is asking for additional staff. I'm on reassignment, Nora said. I know. She's asking for you specifically. Something shifted in the air between them. Nora set down the chart she was holding. What kind of situation? Crawford hesitated. Military. Multiple casualties. The ED is overwhelmed. They've called in everyone they have. She was already untying her station apron. What's the mechanism of injury? I don't have that information. How many patients? I was told at least 6. Possibly more still incoming. She handed the apron to the nurse beside her. Tell Dr. Okafor I'm coming. She took the stairs. The emergency department was a different animal from what she'd left 3 weeks ago. The ordinary controlled chaos of a busy trauma center had been replaced with something denser and louder and more specifically directed. The kind of energy that happens when a system built for a certain volume of crisis is suddenly asked to process something 3 times that size. There were soldiers in the hallways, not patients, escorts, in full tactical dress, standing at specific intervals in a way that told Nora someone had made deliberate choices about security positioning. She noted this without visibly reacting. The triage board had 8 active traumas. Deborah Finch was at the center of it, moving with the efficiency of someone who had burned through everything except competence. She saw Nora and came straight to her. Bay 7, she said. Blast injury, both legs, tourniquet applied in the field. Right tourniquet is slipping. He's been waiting 8 minutes. Who's in there? Nobody. Every attending is occupied. Get me a tourniquet kit and a vascular tray, Nora said. And whoever's the most senior resident who isn't in a critical bay right now. She was moving before Deborah finished nodding. Bay 7 was a young man. Couldn't have been 25. His face was very still in the way that people's faces get when they are marshaling every available resource towards staying conscious, and the tourniquet on his right leg, military issue, CAT, properly applied in the field but jostled somewhere in transit, was losing its purchase against the swelling tissue. Nora gloved up in approximately 4 seconds. Hey, she said to the soldier. I'm Nora. I'm going to fix the tourniquet on your right leg. It's going to hurt. You can make whatever noise you need to. His eyes found her face. Something in them sharpened. Not recognition exactly, but a kind of fundamental assessment, the kind of look that soldiers give to people in chaos, the rapid analysis of, can I trust this person with my life right now? Do it, he said. She did it. She reset the tourniquet with the economy of motion that came from having done it before, in worse places with worse light and worse equipment, and she got it locked and cinched in under a minute, and the soldier's entire body changed, the particular relaxation that happens when a person's body realizes the bleeding emergency has shifted categories. Left leg is stable? She asked. Field medic confirmed arterial flow when they applied. I'm going to check it myself. She moved. She checked. The field medic had been right. You're okay on the left. How's your breathing? Fine. Chest feels fine. Any loss of consciousness at this scene? Couple seconds, maybe. Head pain? Some. Not bad. She was already flagging the potential concussion component in her mental record when she heard it. From somewhere in the bay corridor, a voice, not panicked, but directed and sharp, the voice of someone accustomed to giving orders in loud environments and currently very focused. I need to speak to whoever stabilized Staff Sergeant Doyle, right now. The voice belonged to a man in his early 50s, in military dress that Nora recognized without needing to read the rank insignia, though she read it anyway, out of habit. Brigadier General. Not a colonel. A brigadier general. Standing in the doorway of Bay 7, looking at her, his name tag said Hargrove. Nora finished checking the tourniquet lock and stood. She and Hargrove looked at each other for 2 full seconds, and something happened in those 2 seconds that the nurses nearby couldn't quite name afterward when they tried to describe it. A kind of mutual recognition that had nothing to do with having met before. You applied the reset, Hargrove said. It wasn't a question. Yes. Where did you train? That's a long answer, Nora said. I've got time. I don't. He needs imaging on the head, and I want a vascular surgery consult on the right leg before the swelling progresses another centimeter. Hargrove's expression didn't change. He stepped back. He let her work. But he didn't leave. He stood at the doorway of Bay 7, and he watched her. Not with the evaluating look of a man trying to place someone, but with the specific look of a man who has already placed someone and is now simply waiting for the rest of the room to catch up. Down the corridor, Roland Pryce was emerging from Bay 3, pulling off bloody gloves, scanning the department. He saw the general. He straightened. He began moving in that direction, already composing his face into the particular configuration that doctors used when they needed military brass to know they were the senior person in the room. He hadn't seen Nora yet. In Bay 7, the young soldier named Doyle closed his eyes for a moment and then opened them again and looked up at the lights. Are you military? He asked Nora quietly. She was writing on his chart. Used to be, she said. I knew it, he said. I could tell. How? The way you reset the tourniquet. Nobody does it that clean unless they've done it under pressure before. He paused. Real pressure, not hospital pressure. Nora looked at him. Rest, she said. Stop talking and rest. He almost smiled. Yes, ma'am. In the hallway, Pryce had reached Hargrove and was extending his hand and beginning to explain that he was the department chief and that any questions about the military patients should come through him as the senior attending physician. Hargrove was listening to Pryce with an entirely neutral expression, and then, over Pryce's shoulder, he looked back into Bay 7, at Nora. And something in the general's face, some quality of patience, or perhaps of waiting, went absolutely still. Nora didn't know what was coming, or rather, she knew something was coming, had known it since she heard the rotors the first time 3 weeks ago and felt the pressure change in her chest, that specific vibration of a world she had left trying to find her in the one she had built to replace it. She had built it carefully. She had chosen Denton, Missouri, specifically because it was small and unremarkable, and because the hospital was solid without being prestigious, the kind of place where a person could be competent without being scrutinized. She had applied for the nursing position under her current credentials, which were real and earned, and she had given no resume, no references from the decade before she completed her nursing degree, and nobody had asked. Nobody ever asked. She had been counting on that. She was washing her hands at the Bay 7 sink, preparing to go find a senior resident to take over monitoring, when Marcus Webb appeared in the doorway. His face was doing something she hadn't seen from him before. Not discomfort, something between discomfort and genuine alarm. Nora, he said, there's a general asking for you. I know, she said. Pryce is with him, and Pryce is telling him you're a floor nurse on reassignment and that any questions about patient care should go through him. Nora dried her hands, set the paper towel in the bin. What did the general say? She asked. Marcus swallowed. He said, and I'm quoting, I know exactly what she is. That's what I came to find out. And then he asked someone to please go get her. The corridor outside Bay 7 had gone quieter than it should have been, given that there were still 6 active trauma patients in the department. People were moving carefully, with their peripheral vision doing work that their direct gaze was pretending not to do. Nora walked out of Bay 7. She walked down the corridor. Pryce saw her coming, and his expression shifted through several configurations before landing on something that was trying to be authoritative and arriving instead at merely tight. Voss, I was just explaining to the general that— Nurse Voss, Hargrove said. He wasn't looking at Pryce. General, Nora said. I want to ask you something, Hargrove said, and I want you to answer it honestly. I'll do my best, she said. Do you have a designation? A military designation. From prior service. The corridor had gone very still. She was aware of Deborah Finch at the nurse's station, not moving. Of Marcus Webb somewhere behind her, not moving. Of Pryce to her left, very deliberately radiating the energy of a man who was about to reframe a conversation that was escaping him. Nora looked at Hargrove. She had two choices, and she had approximately 3 seconds to make them, and she had spent years believing the choice was obvious, and years more discovering that the obvious choice and the right choice were not always the same thing. Sierra Kilo 7, she said. The sound that followed was the sound of a room full of people not making a sound. Pryce broke it first. What is that? It's a unit designation, Hargrove said, still looking at Nora. Naval Special Operations Trauma Support, Tier 2 attachment to SEAL and DevGru rescue units. He paused. The designation Sierra Kilo 7 was specifically assigned to a combat trauma specialist who completed 4 deployments between 2016 and 2021 and was cited on 3 separate occasions for, among other things, performing field surgery under active fire with no physician support. Nobody in the hallway was pretending to do anything else anymore. Her name, Hargrove said, with the particular quietness of a man delivering something heavy, in those records is Specialist Nora Voss, which is the same name on your hospital ID badge. He looked at her. You've been working as a floor nurse? Yes, she said, for 9 weeks. 9 weeks, yes. And in 9 weeks, Hargrove said, nobody asked you about your background. Nora held his gaze. Nobody asked. Hargrove turned, slowly, deliberately, with the full weight of military bearing, and looked at Roland Pryce. Pryce's face had done something it almost never did. It had gone uncertain. I'd like to speak with your hospital administrator, Hargrove said. Not to Pryce. To the room. And I'd like Nurse Voss present for that conversation. He turned back to Nora. Is there anywhere here that isn't a hallway? Conference room on 2, she said. I can take you. Please, he said. They walked. And behind them, in the corridor of the emergency department of Harlow General Hospital in Denton, Missouri, the staff stood in the specific silence of people who are recalculating everything they thought they understood about a person they had barely bothered to learn. Roland Pryce stood alone where the general had been standing. His gloves were still in his hand. His mouth was doing something that wasn't quite forming a sentence. Down the hall, the soldier in Bay 7, Doyle, had his eyes open, staring at the ceiling. He was smiling. The conference room on the 2nd floor of Harlow General was the kind of room that existed in every mid-size hospital in America. A rectangular table that was slightly too large for the space. Chairs that had been bought in bulk sometime in the early 2000s and had been slowly losing their lumbar support ever since. A whiteboard with ghost marks from a meeting nobody remembered, and a window that looked out onto the parking structure rather than anything worth looking at. It smelled like old coffee and recirculated air and the particular staleness of a room that was used for difficult conversations and then left alone. Hargrove sat down without being invited to. That wasn't arrogance. It was simply the behavior of a man who had spent 30 years operating in environments where waiting to be invited cost time that people didn't have. He set a tablet on the table and folded his hands over it and looked at the door. Nora sat across from him. Not at the far end, directly across, which was either confidence or practicality, and with her it was hard to tell the difference. The hospital administrator who arrived 4 minutes later was a man named Gerald Poole, 58 years old, reading glasses pushed up on his head, tie slightly loosened in the way that said he'd been in the building since 7 in the morning, and it was now past 9 at night. He came in already talking, which was his default mode when he was nervous, and he was clearly nervous. General Hargrove, I want to apologize for any confusion in the department tonight. We've been operating at capacity, and our staff has been under considerable— Sit down, please, Hargrove said. Poole sat down. Hargrove looked at him with the specific patience of a man who was going to say something once, and needed the other person to be fully present for it. I'm not here about the department's performance tonight. The department performed adequately under difficult circumstances. I'm here about this woman. He indicated Nora without looking at her. And about what I've learned in the last 40 minutes about how she has been used at this hospital. Poole looked at Nora, looked back at Hargrove. Nurse Voss she's currently on a reassignment following a protocol review. I know what she's currently on, Hargrove said. I'd like to know how it happened. The door opened again. Roland Pryce came in, and he came in with the energy of a man who had decided that the best defensive posture was to arrive already talking. General, I want to give you some context about the clinical decisions that were made tonight, because I think there may be some— Dr. Pryce, Hargrove said. I'll get to you. Pryce stopped. He found a chair. He sat in it like a man sitting on something uncomfortable. Hargrove opened his tablet. He turned it to face the table, and what was on it was a document. Not a personnel file, something else, something with a header that Poole squinted at and couldn't immediately read, and that Pryce looked at for 3 seconds before his expression changed in a way he clearly hadn't intended it to. This is a summary of Specialist Nora Voss's service record, Hargrove said, which is partially classified, so I've provided the version that can be shared in a civilian setting. What you can read there covers her 4 deployments, her 3 commendations, her 2 field surgery citations, and her completion of the Naval Special Operations Trauma Support Program, which has a 9% completion rate. He paused. She left service in 2021 under honorable conditions, completed her civilian nursing degree, and applied to this hospital as a licensed registered nurse, which she is. She is also, by any reasonable clinical measure, one of the most experienced trauma practitioners currently working in this building. Poole had gone very still. Pryce had not gone still. Pryce was doing the opposite. A subtle, controlled movement of jaw and shoulder that suggested he was doing significant internal work to keep his face in a professional configuration. I want to be clear, Hargrove continued, that I'm not here in an official investigative capacity. This is not a formal inquiry. I'm here because one of my soldiers is alive tonight because of decisions this woman made, and when I asked about her, I was told she was a floor nurse on disciplinary reassignment. I found that surprising. The reassignment was procedural, Pryce said. She performed a clinical intervention outside her authorized scope. She performed a needle decompression that prevented a tension pneumothorax from becoming a fatality, Hargrove said. He hadn't raised his voice. He didn't need to. And you reassigned her for it. The issue was chain of command. The issue, Nora said quietly from across the table, was that I didn't ask for permission first. Everyone looked at her. She had been so still that her voice landing in the room had the quality of something dropped onto a hard surface. I didn't ask, she said. I walked into a bay with a patient in crisis and I handled it. That's what I was trained to do. I understand why that created a problem institutionally. I'm not arguing the procedure. She looked at Pryce, not with anger, with something worse, the level assessment of someone who is not frightened of you. I'm noting that the thing I did kept a person breathing. Pryce opened his mouth, closed it. Hargrove watched this exchange with an expression that was almost but not quite satisfaction. Mr. Poole, he said, I think you and I should speak privately after this meeting, not about a formal complaint, about talent allocation. He stood. Thank you for making time. He looked at Nora. I'd like you to check on Sergeant Doyle before I leave the building. Of course, she said. She stood, and she and Hargrove left the conference room, and Gerald Poole sat at the table looking at the tablet, and Roland Pryce sat in his chair looking at nothing in particular, and the ghost marks on the whiteboard said nothing useful to either of them. Doyle was awake and had been moved to a monitored bay with better light and a vascular surgery consult already in his chart. He looked better than he had 40 minutes ago. Color returning, eyes tracking properly, the specific loosening of a body that has moved from acute crisis into managed pain. He looked up when Nora came in, then passed her at Hargrove. Sir, he said, and started to push himself upright. Don't, Hargrove and Nora said simultaneously. Doyle settled back. I heard you found her, he said to Hargrove. She wasn't lost, Hargrove said. She was working in this hospital. I know. I felt that tourniquet reset, knew it before anyone said anything. Doyle looked at Nora. I told the general when they were bringing us in. I said, Sir, Whoever stabilized me knows what they're doing in a way that doesn't come from a nursing program. He asked me what I meant. I said I'd had my tourniquet managed by a lot of people over the years, and there's a way that people do it when they've done it in a ditch versus when they've done it in a classroom. You've been injured before, Nora said. It wasn't a question. Twice. Nothing like tonight. He looked at his legs. How bad is the right one? Vascular surgery will tell you that tomorrow. Tonight the blood flow is maintained and the tourniquet is holding. That's the part that matters right now. You're not going to sugarcoat it. No. He nodded, like this was the answer he'd wanted. What's your background, if I can ask? Sierra Kilo 7, she said. Naval Special Operations Trauma Support. Doyle was quiet for a moment. I know that designation. I've heard it in briefings. He looked at Hargrove. Sir, that's Tier 2 attachment, isn't it? It is, Hargrove said. And she's been working here as a floor nurse? For 9 weeks, Hargrove said. Yes. Doyle looked at Nora with an expression that was trying to be neutral and not quite getting there. Why? I needed quiet, Nora said. I wanted to do medicine without the rest of it. The rest of it. The exposure. The institutional weight. The way your history follows you around and tells people who to see before they look at you. She adjusted his IV line, a small, automatic movement, the kind of competence that happened below the level of conscious thought. I didn't want anyone making assumptions about what I could do before they gave me a chance to just do it. And instead, Doyle said, they assumed you couldn't do anything. Mostly, she said. How'd that work out? She looked at him for a moment, then she almost smiled. Not quite, but the near miss of it was visible around her eyes. It had its moments, she said. Hargrove, standing at the foot of the bed, watched this exchange with the expression of a man storing information carefully. The second thing that happened that night, the thing that Nora didn't see coming, which was unusual for her, came from a direction she hadn't been watching. It came from Asha Karim. Nora had been in the corridor outside Doyle's bay, preparing to check on 2 of the other military patients before her shift technically ended, when Asha found her. The first-year resident looked like she had been through something that had reorganized her from the inside. Not broken, but rearranged, the way that people look when a significant event has forced them to update a core assumption. I need to tell you something, Asha said. Okay. About the chart. The notation Dr. Pryce made about what happened with your soldier 3 weeks ago. She stopped, took a breath, let it out. He told me to sign a co-signature on a supplemental note. I didn't know what was in it. I signed it because he's my attending, and I was scared, and... She stopped again. Her jaw was tight. And I found out 2 days later what it said, and I've been thinking about it since then. And tonight, with the general here, I think... Asha, Nora said, I know what I have to do. I just wanted you to know that I know before I do it. Nora looked at her. The resident was 26, maybe 27. And she had the particular combination of genuine ability and badly managed anxiety that was common in people who had excelled academically for so long that they had never developed a framework for navigating institutional pressure. She had done the right thing 3 weeks ago, with the needle, when it mattered most. And then she had done a smaller, easier thing that had been wrong, because the wrong thing had been presented to her with the authority of a supervisor behind it. That was not a remarkable story. That was how a significant percentage of institutional wrongdoing actually propagated, not through malice at every level, but through the ordinary, predictable behavior of people trying to keep their positions. You don't have to tell me about it, Nora said. That's between you and the review board, whenever it gets there. I want to tell you, Asha said, because you walked in when you didn't have to. You didn't know me. You didn't know if I could handle it. You saw what needed to be done, and you did it. The patient needed it done. I know, but you didn't run the math first. You didn't think about whether it was going to cost you anything. Asha looked at her with the directness of someone who was working through something in real time. And then it did cost you, and you didn't. You just accepted it. The reassignment, you didn't fight it. I let it go where it was going to go, Nora said. Why? Because fighting a process that hasn't finished playing out yet is usually how you get the wrong outcome, Nora said. You wait, you let it move, and then when it stops, you see where it's sitting, and that's when you decide. Asha absorbed this. That sounds like patience. It's not patience, Nora said. Patience implies you're at rest while you wait. I was watching the whole time. A beat. Asha looked down the corridor, then back. I'm going to talk to Sylvia Okafor tonight, while the general is still in the building. That's your decision, Nora said. I mean that. I'm not telling you to do it. But if you do it because it's what you think is right. Not because of tonight, not because of the general, because it's right. Asha nodded once, then she went. Nora stood in the corridor for a moment. Around her, the emergency department was beginning to decompress. The military patients stabilized, the attendings moving back to their ordinary rotation, the controlled intensity of the last 2 hours settling into the managed tempo of a hospital night. She went to check on the other patients. What Nora didn't know, while she was doing her rounds, was that Sylvia Okafor had been doing something in the background for the last 45 minutes that was going to change the geography of the next morning considerably. Sylvia was not a dramatic woman. She did not operate on the surface of things. She had spent 30 years in hospital administration specifically because she was comfortable existing in the space between what was visible and what was true. And she had a talent for understanding, very quickly, when the two had diverged dangerously. She had understood it in the meeting with Nora 3 weeks ago. She had understood it in the way Pryce had framed his complaint. Too clean, too procedurally precise, with the kind of righteous certainty that people had when they were trying to bury something under the weight of correct language. She had made a note. She had filed it in a mental category she called waiting. Tonight had moved the category. While Hargrove was in the conference room with Poole, Sylvia had pulled 3 things. Nora's personnel file, which told her very little because Nora's military service wasn't in it. The incident report from the patient 3 weeks ago. And the supplemental notation that Pryce had filed, with Asha's co-signature. She read the notation twice. Then she pulled the original nursing notes from that night, which had been entered in real time by the Bay nurse on duty, and which told a materially different story from the supplemental notation, specifically regarding who had been in the Bay first, who had given which instructions, and what the patient's status had been when the attending arrived. She placed these documents side by side on her desk and looked at them with the expression of someone who is not surprised but is nonetheless unhappy. She was still looking at them when Asha Karim knocked on her office door and bowed. Nora's shift ended at 11. She stayed until 12:30, not because anyone asked her to, but because there were 2 patients still being monitored after the military surge and the department was running thin on experienced staff. She did not announce this decision. She simply stayed. At 12:40, she was in the break room with a cup of coffee that she had microwaved from the morning pot, and which tasted accordingly when Marcus Webb came in and sat down across from her without being invited, which was by this point an established pattern between them. "The general left," he said. "I know." "He talked to Poole for almost an hour." "I know." "Did he talk to you? After?" "Briefly," she said. Marcus waited. When it became clear she wasn't going to elaborate, he leaned forward with his elbows on the table. "Nora, what did he say?" She considered the question. She looked at her coffee. "He said that he was going to submit a formal commendation to the hospital on behalf of the military patients treated tonight, and that he intended to include specific language about the care provided by nursing staff." She paused. "He also said that he was going to make a personal request to the hospital's clinical review board that my service record be considered as part of any ongoing personnel review." Marcus stared at her. That will override Pryce's documentation." "It will complicate it," she said. "It's not a guarantee." "It's pretty close." She drank her coffee. "Maybe. Are you not even a little bit satisfied right now?" She thought about this carefully because she was someone who was careful about her internal states, who had learned that naming a feeling incorrectly was worse than not naming it at all. "I'm tired," she said. "I'm relieved about the patients. The soldier with the legs, Doyle. He's going to need significant rehab, but he's going to walk again, which wasn't certain 40 minutes ago. That matters to me." She set the cup down. "The rest of it is it's institutional movement. It's going in the right direction, but it's slow and it's messy, and there are going to be 3 more meetings before anything is actually resolved." "You've dealt with a lot of bureaucracy," Marcus said. "I've dealt with a lot of everything," she said. He was quiet for a moment. Then, "Can I ask you something personal?" "You can ask." "Why nursing? After everything you did, the deployments, the field work, Why not medicine? You could have gone to medical school. Nora wrapped both hands around her cup. Outside the break room window, the parking structure was dark except for the security lighting, and somewhere in it there was probably still a scuff mark on the pavement from where the helicopter rotors had blown a coffee cup off a cruiser hood. Because medicine would have put me in charge of rooms again, she said. I'd been in charge of rooms for a long time. I wanted to be in the room without being responsible for the room. She paused. It didn't work out quite that way, but that was the original idea. Marcus nodded slowly. And now? Now I'm drinking terrible coffee at 12:40 in the morning, she said. Ask me again in a week. He almost laughed. It didn't quite make it to a full laugh, but it made it further than she'd expected. She was finishing the coffee when her pager went off. Not the hospital pager. Her personal phone, a text, from a number she recognized immediately, a number that should not have had her current location or her current contact information, because she had been very deliberate about separating her present life from her prior one. The text said 3 words. We need you. She looked at the screen. She looked at it for a long time. Marcus was watching her face. What is it? She turned the phone face down on the table. Nothing, she said. Old contact. But her hands had gone very still. And the quality of her stillness had changed. From the managed, deliberate stillness she maintained in the hospital, the practiced calm of a woman who had decided not to let the room read her, into something older and deeper and considerably less controlled. Because she recognized the number. It belonged to a communications relay used exclusively by the unit she had left in 2021. A unit that had been officially stood down. A unit that, by every document she had ever signed, no longer existed in any operational capacity. The kind of unit that only made contact when something had gone wrong in a way that civilian infrastructure couldn't handle. She picked the phone back up. She read the 3 words again. We need you. Her coffee sat on the table getting cold. Marcus was saying something. She could hear the shape of the words without processing them, because her mind had already moved somewhere else entirely, back through years of training and deployment and impossible decisions made in the dark, back to the version of herself that she had been trying to leave quietly in a storage unit somewhere in her own history, the version that didn't stay quiet when someone called it by its real name. She typed 1 word back, when. The response came in 11 seconds, now. She stood up. She picked up her bag. She looked at Marcus Webb, who was watching her with the expression of a man who understands that a conversation has just become a different kind of conversation without being able to identify exactly when the transition happened. I have to go, she said. Where? She slung the bag over her shoulder. I don't know yet, she said, which was the truth. But I'll be back. She walked out of the break room, through the corridor, through the automatic doors of Harlow General's East Wing exit, and into the parking lot, where the night air was cool and smelled like rain that hadn't arrived yet. She was halfway to her car when the second message came. This one wasn't 3 words. This one was a set of coordinates, a timestamp that was 47 minutes from now, and a code that she hadn't seen used in active communication in 3 years. A code that meant military personnel in immediate danger, civilian location, no federal response authorized. She stopped walking. She stood in the parking lot of Harlow General Hospital in Denton, Missouri, with her bag on her shoulder and her phone in her hand and the cool pre-rain air moving around her, and she understood with complete clarity that the life she had been carefully, deliberately constructing in the quiet margins of this unremarkable hospital in this unremarkable city had just run out of runway. Whatever was at those coordinates, whoever had sent the code, it was going to find her whether she went or not. The only question was whether she arrived as herself, or as someone who'd been pretending. She got in the car. She drove with the phone propped against the center console and the coordinates loaded into a Maps app she'd downloaded specifically because it didn't log history, a habit left over from a life that had required habits like that. The destination resolved into an industrial area on the eastern edge of Denton, warehouses, a decommissioned rail depot, the kind of geography that existed in every mid-size American city as a record of what the economy had been before it became something else. 12 minutes out. She hit the highway and pushed the car to 80. The pre-rain smell had become actual rain by the time she merged, a light persistent drizzle that the wipers handled in their irregular, slightly off rhythm that she'd been meaning to fix for 2 months. She drove through it and ran the situation in her head the way she had been trained to run situations. Not catastrophizing forward, not anchoring to past experiences, but assembling what she actually knew and keeping the unknown clearly labeled as unknown. What she knew, a communications relay from her former unit, officially decommissioned, had sent her a contact code that indicated military personnel in danger at a civilian location with no authorized federal response. She knew the code was legitimate because it contained an authentication suffix that changed on a rotating schedule she still had memorized, a fact that said something about how thoroughly she had actually left her old life versus how thoroughly she had believed she was leaving it. What she didn't know: how many personnel, what the nature of the threat was, who had activated the relay, and from what authority, and whether going to those coordinates was the right decision or a decision that was going to unravel 9 weeks of deliberate quiet living in approximately 40 minutes. She went anyway. She had typed when, and they had said now, and she had gotten in the car, and the moment for reconsidering that chain of events was probably somewhere behind her on the highway. The coordinates put her in front of a former rail depot building, a long, low structure in gray concrete that had been somebody's logistics center in the 1990s, and had been sitting vacant long enough that the parking lot weeds had cracked through the asphalt in organized lines. There were 2 vehicles already there, both dark-colored, both with the specific plainness of government vehicles that were trying not to look like government vehicles. She parked at an angle that gave her options and got out. A man was at the depot entrance before she reached it. She recognized him before she saw his face. The posture first, then the gait, then the face confirming what the posture had already told her. His name was Cal Rutherford, and he had been her unit coordinator for the last 18 months of her deployment, and he looked like he had not slept in approximately 36 hours and was running on the kind of functional adrenaline that was going to cost him significantly once it ran out. "You came," he said. "I drove 12 minutes in the rain," she said. "What's the situation?" "Inside," he said. "I'll explain inside." The interior of the depot was lit by portable work lights that threw hard shadows in every direction. In the center of the space, on a cleared section of concrete floor, there were 3 people. 2 of them were sitting upright, military, she could see that immediately, in civilian clothes but with the particular physical economy of trained personnel. The third was lying on a field litter that had been set up with improvised elevation, and even from 20 feet away Nora could see the quality of his stillness and understand that it was not sleep. "How long?" she said, moving toward the litter. "He was hit 6 hours ago," Cal said, following her. "We couldn't move him through any official channel. The operation—" "Tell me what happened to him, not the operation. What happened to him physically?" Cal pulled out a phone and read from it with the efficiency of someone relaying information they'd received secondhand. "GSW, right side. They think it caught the lower lobe of the lung. Entry wound here." He indicated his own side. "No exit. Bullet still in. He's been breathing, but it's been getting harder. Heart rate has been climbing for the last 2 hours." Nora was already kneeling beside the litter. The man on it was in his late 30s, dark-haired, with the kind of face that was hard to read even in stillness because it had been trained into a neutral configuration over years. His color was wrong. Not dramatically, but wrong in the specific way that said his oxygen delivery was losing a fight. She put her fingers at his neck. Pulse rate, 112, 113. Not catastrophic, but moving. "I need someone to hold a light here," she said, "and I need whatever medical kit you have." One of the seated soldiers, a woman, compact and watchful, moved immediately. She held the work light while Nora opened the man's shirt and examined the wound. The entry site on his right flank had been field dressed with a chest seal, properly applied, but the seal was doing what all seals eventually did in untreated pneumothorax, holding a situation stable that was nonetheless deteriorating underneath. "His trachea," Nora said. "Is it midline? Look for me." The soldier with the light looked. "Hard to tell. Maybe slightly left?" "That's deviation. He's developing tension on the right." She sat back on her heels and looked at Cal. "What do you have?" "Exactly. Tell me exactly what's in the kit." Cal handed her a military-issue individual first aid kit that had been supplemented, she could see this immediately, with additional materials that did not come from standard military supply. Someone had gone shopping. She inventoried it in 30 seconds. Needle decompression kit, tourniquet, hemostatic gauze, IV supplies, a bag of saline, a pulse oximeter, 2 rolls of surgical tape, a chest tube tray that was incomplete but workable, and a vial of lidocaine. She looked at the lidocaine, looked at the chest tube tray. I need to decompress him first, and then we're going to have a conversation about whether I can drain this without putting him in more danger than he's already in, she said. Because the honest answer is that this needs a surgical suite and a thoracic surgeon, and he doesn't have either. Surgical suite and a thoracic surgeon, and he doesn't have either. He doesn't have time for either, Cal said. I know that. She was already preparing the needle decompression. I'm telling you what he needs so you understand what we're doing is a bridge, not a solution. He needs a hospital after this. That's the problem, Cal said. There's a situation with the hospital. She stopped. She looked at him. What kind of situation? Pryce, he said. Roland Pryce. He filed a report tonight, after the general left. Not with the hospital review board, with the state medical licensing authority. He's claiming you performed unauthorized surgical interventions on military patients without physician oversight, and that you misrepresented your credentials to the military liaison. Cal paused. He's claiming you're a danger to patients, and he wants your nursing license flagged pending investigation. The rain hit the depot roof in a steady percussion. The man on the litter breathed in shallow increments. Nora looked at Cal for 3 seconds. Then she turned back to the patient. I'll deal with that later, she said. Hold the light still. She performed the needle decompression with the same economy she'd used on Doyle 3 hours ago. Second intercostal space, mid-clavicular line, the hiss of releasing pressure, immediate. The patient's breathing changed, not dramatically. He was still struggling, the underlying injury still present. But the character of it shifted, the desperate top-of-the-chest quality giving way to something slightly deeper. The pulse ox she'd clipped to his finger ticked up. 89, 91, 93. Okay, she said, more to herself than anyone. Okay. She sat back and looked at the chest tube tray. This was the decision point. A needle decompression bought time. Minutes to an hour, depending on the underlying injury and the rate of air reaccumulation. The bullet in his lower lobe meant there was ongoing leak, which meant the time window was at the shorter end. A chest tube would give him more runway, but performing it here, on a concrete floor, with a partial kit and no imaging and no anesthesiologist, introduced risks that were not trivial. What's his name? She said. Cal hesitated. I'm not asking for operational details, she said. I'm going to put a tube in this man's chest. I'd like to know what to call him. Reeves, Cal said. Aaron Reeves. She looked at the patient, at Reeves. He was she realized. His eyes were open now, watching her. Not panicked. Watching her the way Doyle had watched her. That fundamental assessment. Can this person be trusted with my life? Reeves, she said. I'm Nora. I'm going to tell you what I'm going to do, and then I'm going to do it. You'll feel pressure when I numb the area. After that, it shouldn't be sharp pain, but it's going to be uncomfortable, and I need you to stay as still as you can. His voice, when it came, was rougher than she'd expected. Are you a doctor? No, she said. I'm better than a doctor for this particular situation. Something shifted in his expression. The assessment resolved. Okay, he said. Okay, she said. She prepped with the lidocaine and gave him enough time for it to work. 3 minutes, which felt much longer than 3 minutes, in a concrete depot with portable work lights and rain on the roof. And then she put the chest tube in with the careful, deliberate focus of someone who was doing a thing they had done before in harder circumstances, and who understood that past success was informative but not a guarantee. It went in. There was blood-tinged drainage, which was expected, and a sustained air leak, which told her what she'd already suspected about the bullet's position relative to the lung tissue. She secured the tube, connected it to the improvised drainage system she'd assembled from the kit's components, and taped everything with the surgical tape. Reeves had made sounds through the procedure, but he hadn't moved. The soldier holding the light had not moved. The other seated soldier had moved only to take over the pulse ox monitoring and call out numbers in a quiet, even cadence. When she sat back, her hands were steady. Her knees hurt from the concrete. 96, said the soldier with the pulse ox. Good, she said. Keep watching him. Heart rate? 98, coming down. She stripped her gloves, looked at Cal. He needs a hospital in the next 3 to 4 hours, she said. That tube is managing the pressure, but the bullet is still in there, and I can't see what it's touching from the outside. He could be bleeding internally in a way that's slow enough that we haven't seen it yet. You understand? I understand, Cal said. So explain to me why you can't take him to Harlow General. Cal pulled a chair from the wall, a folding chair that had been left by whoever had last used this building for something, and sat in it with the posture of a man settling in to tell a story he'd rather not tell. The operation tonight wasn't sanctioned, he said. 3 members of a unit that was officially decommissioned, including Reeves, were running surveillance on a target that several federal agencies have been building a case against for 18 months. Someone leaked the surveillance position. They got made. 2 of them got out clean. Reeves caught 1 round before they broke contact. Who leaked it? She said. We don't know yet. That's part of the problem. If we take him through official channels, we're announcing to whoever leaked the position that we're still operational. We're potentially burning the 18 months of federal casework. We're also exposing 3 people who officially don't exist to scrutiny they can't survive right now. Nora listened to this. She had heard operational explanations like it before. The logic of classified action, which had its own coherence when you were inside it, and which looked considerably more complicated from the outside. You called me, she said, because I'm the only person you know who can do this work who isn't in the system. You're the only person who can do this work at all, Cal said. And yes, you're outside the system right now. Pryce is trying to put me further outside it, she said. I know, I heard about it 20 minutes ago. Who told you? The general, Hargrove. He's been watching what's happening at your hospital since he left tonight. Cal leaned forward on the folding chair. He didn't leave because he was satisfied, Nora. He left because he needed to make some calls. She looked at him. What kind of calls? The kind that require a secure line, Cal said. He knows about Pryce's filing. He found something in Pryce's administrative record, something that has nothing to do with you. Outside, the rain was getting heavier. The roof of the depot was not in perfect condition, and in one corner a slow drip had started, hitting the concrete floor in a metronomic rhythm. Tell me, she said. 3 patients over the last 2 years, Cal said. Outcomes that were documented as complications, but that 2 separate internal reviews flagged as potentially connected to intervention decisions Pryce made. Both reviews were closed. The person who closed them was Gerald Poole. Nora was very still. Poole's been covering for him, she said. Not necessarily knowingly. The reviews were closed on the grounds of insufficient evidence, and that may be exactly what Poole believed. But Hargrove's people looked at the underlying records tonight, and the picture they're describing it's not a good picture, Cal paused. Pryce isn't just a difficult administrator. He's someone who has been making decisions that prioritize his professional standing over patient outcomes for a long time, and the institution has been absorbing it. The drip in the corner hit the floor. Hit it again. Nora looked at Reeves on the litter. He was awake, listening, too professional to react visibly to what he was hearing, but not so far gone that he wasn't processing it. How does this connect to tonight? She said. The filing against my license. It connects because Pryce is scared, Cal said. The general showing up, the commendation, Asha Karim going to Sylvia Okafor. He can feel the ground shifting. The license filing is a preemptive strike. If he can get your credentials flagged before the review board convenes, he controls the narrative. You're not a wrongly marginalized combat trauma specialist. You're a nurse with a pending investigation. She understood this. It was the kind of move she had seen before in institutional contexts. Not the dramatic confrontation, but the quiet procedural one. The move that buried something before it could surface. In a hospital environment, a flagged nursing license was a serious enough intervention that it would slow everything down, create uncertainty, give Pryce time to rebuild his framing. It was smart. She didn't want to give him credit for it, but it was smart. What does Hargrove want? She said. He wants you back at the hospital tomorrow morning, Cal said. He's going to be there, and he's bringing someone with him. Who? The regional director of the Federal Health Oversight Board, Cal said, who is also, as it happens, a retired Navy captain who did 2 tours attached to the same command structure as your unit. He looked at her. This isn't just about you anymore. Hargrove's been building something since he left that hospital tonight, and you're central to it, but you're not all of it. She absorbed this. She looked at the depot roof, at the portable work lights throwing their hard geometry, at the man on the litter breathing in steadier increments than he had been 40 minutes ago. I'm going to need someone watching Reeves through the night, she said. I'll write down what to watch for. Heart rate, oxsat, the drainage tube output. If the drainage stops and his pressure starts dropping, that's an internal bleed and you get him to a hospital regardless of operational concerns. Do you understand? Understood, Cal said. I mean it. No amount of classified anything is worth watching a man bleed out slowly because you didn't want to make a phone call. I know, Cal said, and he said it in a way that meant it. She spent 20 minutes writing the monitoring protocol on paper, actual paper, a notepad from the desk against the wall, in handwriting that was compact and clear, and walked the soldier with the pulse ox through each item. The woman was sharp. She asked two good questions and absorbed the answers without requiring them to be repeated. Nora gave her the remaining lidocaine and the spare IV materials. She assessed Reeves one more time. Color better, sat holding at 95, pulse down to 92. You're more stable than you were, she told him. That's the good news. The tube is draining and the pressure is managed. Don't move more than you have to. Understood, he said. His voice was a little stronger. You'll get to a hospital, she said. Tonight, tomorrow. But you'll get there. You sure about that? I put a chest tube in on a concrete floor with a partial kit, she said. I'm trying not to catastrophize from here. He almost laughed. It became a cough, which she monitored and which resolved without alarming developments. Who are you? He said. Not rhetorically, actually asking. Nora Voss, Sierra Kilo 7. A pause. I've heard that call sign. Apparently everyone has, she said. Rest. She stood, picked up her bag, and looked at Cal. He walked her to the door. At the entrance, with the rain coming down properly now, she stopped. The monitoring protocol on this paper. Timestamps every 30 minutes. If he spikes above 115 or his SAT drops below 90, you call me before you do anything else. Copy, Cal said. And Cal. She turned to look at him directly. Who activated the relay? Who sent the message? He met her eyes. Hargrove, he said. He's had our emergency contact infrastructure on file since the unit was stood down. He activated it through back channels 2 hours after he left your hospital. She held this. He knew I'd come. He said... Cal stopped, looked at the rain. He said that someone who spent 4 years running toward the hardest thing in the room wasn't going to stop just because the room was a parking lot in Denton, Missouri. She looked at him, looked at the rain. Get him through the night, she said. She walked to her car. Well, she drove back toward Harlow General, not because her shift was active. It wasn't. She was officially off the clock at 11, and it was now past 2 in the morning, but because there was nowhere else that made as much sense to be. The hospital was where the situation was unfolding, and she had learned that the right place to be when something was in motion was close enough to see it. She was 10 minutes out when her phone rang. Not a text, an actual call, from a number she didn't have saved but which she recognized as a Denton area code. She answered. Voss. Nurse Voss. A woman's voice, measured. This is Sylvia Okafor. I apologize for the hour. Don't, Nora said. What's happening? Dr. Pryce filed a complaint with the state licensing board this evening, Sylvia said. I've been informed by the board's duty officer that a preliminary flag has been placed on your nursing license pending review. It's administrative. It doesn't prevent you from working, but it creates a record. A pause. I want you to know that I was not consulted before this filing, and I did not support it. I know, Nora said. I've also spoken with Dr. Karim tonight, at length. A longer pause. She provided me with a written account of the events 3 weeks ago, including the supplemental notation and her account of what she was asked to sign. I want you to know that I take what she's described seriously. I know that too. Is there anything you need tonight? Anything I can do that would be useful in the next few hours? Nora thought about this. She was on the highway, the wipers doing their irregular work, Denton's lights visible as a smear ahead of her. Pull Pryce's case outcomes for the last 2 years, she said. Specifically the 2 internal reviews that were closed. I want to know what's in the underlying records. Silence. How do you know about those? I know about a lot of things, Nora said. Pull the records. I need them accurate and complete before tomorrow morning. Another pause. When Sylvia spoke again, her voice had shifted. Not dramatically, but the register was different. The register of a woman who had just updated an assessment. I'll have them ready by 6, she said. Thank you. Nurse Voss, whatever is happening, I want you to know that I believe the review board will reach the right conclusion, eventually. Eventually is the part I'm working on, Nora said. Good night, Sylvia. She pulled into the Harlow General parking lot at 2:40 in the morning. She sat in the car. The rain on the roof was loud. She thought about Reeves on the litter in the depot. She thought about the bullet in his lung. She thought about Cal's 36-hour face and Hargrove's whatever he was building and Pryce's license flag, which was a small, clean piece of procedural damage that would cause her exactly the kind of slow, grinding problem that was hardest to resolve quickly. She thought about what the soldier Bernard on the third floor had said. You move like you're always checking the room. She had said she'd seen some things. What she hadn't said was that she had spent 10 years learning that the room that required the most checking was never the one you were already watching. It was always the one adjacent, the one you'd written off as manageable. She pulled up the licensing board notification on her phone. Preliminary flag, pending review. Case number. Complaint filed by Dr. Roland Pryce, MD, Department Chief, Emergency Surgery, Harlow General Hospital, Denton, Missouri. She read the complaint summary. It was careful. It was thorough. It cited her intervention with the tension pneumothorax 3 weeks ago, her presence in the trauma bays tonight, the needle decompression with Doyle, the directive she'd given to Asha Karim. It described each one in clinical language that was technically accurate and contextually devastating, removing the emergency, removing the stakes, removing the patient outcomes, and leaving only the protocol deviations standing. It was, she thought, genuinely well written. She could recognize craft even when it was being used against her. She was still sitting with it when her phone lit up with a message from a number she didn't recognize. Not Cal's relay, not Hargrove's line. A new number, with a Missouri area code, and a message that said only, "Look at who filed the 2 closed reviews." She stared at the screen. She went into the records Sylvia had already begun pulling. She'd been fast, faster than 6 in the morning. She'd clearly started the moment the call ended. And she found the closed review files, and she looked at the name on both closure authorizations, and she felt something in her chest go very cold. The name was not Gerald Poole. The closure authorizations had been signed by a clinical oversight officer, a position that had been filled for the past 3 years by a rotating appointment from the state licensing board. The current occupant of that position, she saw as she scrolled to the appointment record, was the same person who had filed the preliminary flag on her license tonight. Not a subordinate of Pryce's, not someone Pryce had pressured, a name she didn't recognize, a name that appeared in 3 places, the 2 closed reviews and the licensing flag, which meant that the man running her out of the hospital wasn't just protecting his reputation, he was protected. Someone outside the hospital had been running interference for Roland Pryce for 3 years. Someone with enough institutional access to close internal reviews and issue licensing flags. Someone who had now, in the last 6 hours, activated both capabilities in the same night. Nora sat in the rain-loud car in the parking lot of Harlow General and understood, with the clear, unwelcome precision of someone who had spent a decade inside classified operations, that what she was looking at was not a difficult doctor with a fragile ego. It was something considerably more organized than that, and she was sitting in the parking lot of the institution at the center of it. Her phone rang. The unrecognized Missouri number. She answered. The voice on the other end was a woman's, young, tightly controlled, with the specific cadence of someone reading from notes they had compiled very recently and were certain about. Nurse Voss, the voice said. My name is Agent Dana Merritt. I'm with the Federal Bureau of Investigation, Organized Crime Division. I've been watching Harlow General Hospital for 14 months. A pause. And I think you just figured out the same thing I've been trying to prove since February. Nora didn't answer immediately. She sat with the phone against her ear and listened to the rain and the silence on the other end. The silence of someone who had said their opening and was now waiting with the patience of a person accustomed to waiting, which was its own kind of information. How did you get this number? Nora said. General Hargrove, Agent Merritt said. He reached out to our field office 2 hours ago. He had concerns about the licensing filing and about some financial irregularities he'd identified in Harlow General's administrative records. His people are thorough. How long have you been in the parking lot? Nora said, a pause. 40 minutes. Nora looked at the cars around her. She identified the vehicle. A dark blue sedan 3 rows back, engine off, no interior light. She hadn't clocked it when she pulled in, which bothered her slightly. Come to my car, she said. We'll talk here. Merritt was in her early 30s, with short dark hair and the kind of face that was designed by long practice to project neutrality. She was wearing a jacket that was slightly too warm for the season, which meant she was carrying under it. She got into the passenger seat without preamble and pulled a tablet from inside the jacket. "I'm going to show you something," she said, "and then I want to know if it matches what you found." The tablet showed a financial schematic. At the center was a name Nora recognized from the closure authorizations, a man named Warren Schultz, the state licensing board's clinical oversight officer. Lines ran from Schultz outward to three entities: a medical liability consulting firm, a pharmaceutical distribution subsidiary, and a private equity group that had been, for the past 4 years, quietly acquiring failing regional hospitals across the Midwest. Harlow General was on the acquisition list. "Pryce isn't the architect," Merritt said. "He's the mechanism." Schultz identifies hospitals with clinical liability exposure, places where there's documented internal conflict, contested outcomes, staff complaints that got suppressed. Pryce creates the environment. He documents problems that don't exist, suppresses outcomes that do, and builds a paper record that makes a hospital look like it's one lawsuit away from insolvency. Then Schultz's client acquires it for pennies. "And Pryce gets what in return?" Nora said. "Debt cleared. He had $400,000 in outstanding malpractice premiums from a previous position. Those premiums disappeared 8 months after he arrived at Harlow General." Merritt scrolled to another page. "He also has a consulting contract with the liability firm. $60,000 a year, no deliverables on record." Nora looked at the schematic. She was quiet for a moment. "How close are you to being able to act on this?" "We were 6 weeks out," Merritt said. "Then tonight happened. The licensing flag on you. Schultz moved faster than we anticipated. We think Hargrove's calls spooked him. He's trying to close the loop on anything that could become a liability before we get a warrant." "I'm the liability," Nora said. "You're the variable he didn't account for," Merritt said. "A combat trauma specialist with military commendations working as a floor nurse in his target hospital. That's not something anyone could have predicted. When you stabilize those soldiers, when Hargrove came in, when Kareem went to Okafor, all of that creates witnesses and documentation and institutional attention that disrupts his timeline significantly." Nora absorbed this. She looked at the schematic on the tablet and thought about the 9 weeks she had spent at Harlow General, the supply runs, the pediatric waiting room, the patient named Bernard who had told her she moved like a soldier. She thought about Pryce's consistent, quiet erasure of her from anything that mattered, and she understood now that it had not been simply professional arrogance. He had been managing his environment the way he always managed it, identifying variables and reducing them. He had identified her as a variable and tried to reduce her. It hadn't worked. "What do you need from me?" she said. "Tomorrow morning," Merritt said. "Hargrove is bringing the regional federal health oversight director. We need you present. We need your account of the chart alteration, the reassignment, and everything that happened tonight in the ED, on the record, with a federal witness." "Pryce will have legal representation by morning," Nora said. "Probably. Schultz will have called him by now." Merritt paused. "It doesn't change what we need. Your testimony, combined with Kareem's written account and the financial records we already have, is enough to pull Schultz's authorization to operate and freeze the acquisition process. Pryce loses his protection. Without Schultz, the licensing flag on you dissolves. He's the one who issued it, and his authority to do so evaporates if he's under federal investigation." Nora was quiet. The rain was slowing, finally. The windshield was beginning to clear in the places the defroster reached. "There's something else," she said, "something I was involved in tonight that can't be in any federal record." Merritt looked at her steadily. "Hargrove told me," she said. "I don't have a warehouse in my notes. I've never heard of a rail depot on the east side of Denton." She held Nora's gaze. "That's not my case." "Thank you," Nora said. Merritt got out of the car. At the door, she stopped. 7 o'clock, she said. "Hargrove will be in the administrator's conference room. Don't be late." "I won't," Nora said. She watched the dark blue sedan pull out of the parking lot. She sat alone in the car for another few minutes, not thinking, or rather, not thinking in the active, directed sense, but allowing the information to settle into its appropriate structure, the way that data did when you stop trying to organize it and let the significant parts surface on their own. What surfaced was this. She had come to Denton looking for a quiet corner of the world where she could do medicine without the weight of what she'd been. She had found, instead, a situation that was larger and more deliberately constructed than anything she'd encountered in 9 weeks of supply runs and pediatric waiting rooms. She had not created it. She had not gone looking for it. It had been here when she arrived, running underneath the ordinary institutional life of the hospital like a pipe that was corroded and pressurized and waiting for someone to disturb the ground above it. She had disturbed the ground. She went inside to find somewhere to sleep for 3 hours. She found a call room on the 4th floor that wasn't occupied and set her phone alarm for 6:15, and she slept the way she had learned to sleep in the field, completely, without resistance, the way you crossed a threshold into a dark room without hesitating, because hesitating at the threshold was its own kind of exhaustion. At 6, she was already awake, ahead of the alarm. She used the call room bathroom, changed into the spare scrubs she kept in her bag, a habit, like the Maps app, and went down to the cafeteria, which opened at 6 for early staff. She got coffee that was better than what she'd microwaved at midnight, and a breakfast sandwich she ate without enthusiasm, but with the practical understanding that her body needed fuel regardless of what she felt like. She pulled up the record Sylvia had sent at 5:47 in the morning, time-stamped with the impeccable efficiency of a woman who had apparently not slept at all. The underlying records of the 2 closed reviews were exactly what Merritt's schematic had suggested they would be. The first review involved a 61-year-old patient who had died following a surgery in which Pryce had made a decision to proceed without a recommended pre-op imaging sequence, citing time constraints. The imaging, had it been done, would likely have identified a vascular anomaly that turned the surgery into an arterial emergency. The internal review had flagged the decision as potentially non-standard, but had been closed on the grounds that the standard of care threshold was ambiguous in time-critical scenarios. The closure had been signed by Warren Schultz. The second review was more recent, 8 months ago. A 44-year-old woman with a post-surgical complication that had been documented as an unforeseeable outcome, but that the review notes described, in language that someone had tried hard to make bureaucratic and that succeeded mostly in being bureaucratic, as potentially connected to a medication decision made by the attending physician who was listed by ID number rather than name, but whose ID Nora cross-referenced to Pryce's personnel file in under 2 minutes, closed by Schultz. Same language. Same threshold argument. 2 people whose deaths had been smoothed into paperwork. She sat with her coffee and felt the particular weight of that. Not performed emotion, but the real thing, the heaviness that came from understanding that the quiet institutional damage she was looking at had a human bottom that was not abstract. She sent Sylvia a message. "I've read the records. Keep them accessible this morning. We'll need them in the conference room." Sylvia responded in 4 minutes. "Already printed. I'll be there at 6:45 p.m. By 7 o'clock, the second-floor conference room was considerably more populated than it had been the previous evening. Hargrove was there, in dress uniform this time, rather than the operational dress of the previous night, which was its own statement about what kind of meeting this was. Beside him was a woman named Kathleen Dre, Regional Director of the Federal Health Oversight Board, retired Navy captain, with the posture of someone who had spent 30 years being the most authoritative person in rooms full of authoritative people and had arrived at a place of complete comfort with that fact. Merritt was there, in a different jacket, but the same calibrated neutrality. Sylvia Okafor was there with a folder and the expression of a woman who had made peace with the fact that today was going to be one of the harder days of her career and was prepared to do it correctly. Gerald Poole arrived at 7:05, read the room in approximately 3 seconds, and sat down heavily in the chair nearest the door with the expression of a man who understood that the geography of the next hour was going to require him to revise several positions he had held with some confidence. Roland Pryce arrived at 7:12 with a lawyer, a fast acquisition, which told Nora that Schultz had indeed called him, and that Pryce had understood the call for what it was. The lawyer was a compact man in his 50s named Garrett, who had the focused, unreadable expression of someone very good at managing disclosure. He scanned the room. His gaze landed on Merritt and stayed there for a beat longer than it moved across anyone else, which told Nora he'd recognized the category, if not the individual. Nora was sitting on the far side of the table, to Hargrove's left. She had her hands flat on the table and she was not performing calm. She was calm, in the durable, factual way of someone who had done their preparation and now had nothing to do but be present for what the preparation had made possible. Pryce looked at her when he came in. She looked back. He looked away first. She noted this without satisfaction. Kathleen Dre opened the meeting without preamble. This is an administrative review under Federal Health Oversight Authority. It is being recorded. Everyone present should consider their statements accordingly. She looked at Garrett. Your client's legal counsel is noted. He may advise, not speak on the record unless I direct a question to him. She looked at the room. We're here to address 3 matters. A licensing board flag filed against Nurse Voss, documented alterations to patient records in this facility, and clinical outcome reviews that were closed under irregular circumstances. We'll take them in that order. Garrett said, my client would like to note that the licensing flag was filed in good faith based on documented protocol deviations. It was filed by Warren Schultz, Dre said, who is currently the subject of a federal financial investigation. She set a document on the table. His authority to issue licensing flags was suspended at 6:15 this morning. The flag on Nurse Voss's credentials is void as of this moment. She looked at Nora. For the record, your license is clear. 3 seconds of silence. Pryce's face did something that his lawyer caught and touched his arm to stop. The second matter, Dre continued, is the supplemental patient record notation from November of this year, in which the clinical actions of Nurse Voss during an emergency intervention were documented in a manner inconsistent with contemporaneous nursing notes and the account of the resident physician present. She looked at Sylvia. Ms. Okafor, you have the original notes? I do, Sylvia said, and opened her folder. What followed was 22 minutes of careful, documented dismantling. Sylvia laid out the original nursing notes, time-stamped, entered in real time by the Bay nurse on duty. Asha Karim's written account, signed and dated from the previous night. The supplemental notation that Pryce had filed and asked Asha to co-sign. The 3 documents, placed side by side, described 3 different versions of the same event, and 2 of them agreed with each other. Pryce's lawyer tried twice to redirect. Dre let him finish each time and then returned precisely to where she'd been, which was the move of someone who had sat in many rooms with many lawyers and had never once been successfully redirected. Hargrove spoke once, toward the end of the record section. I want to add for the record that my assessment of the care provided to military patients at this facility last night, including care provided by Nurse Voss, is that it was exceptional by any standard, civilian or military. The formal commendation I filed this morning includes specific citations. He looked at Pryce. I want that context present alongside whatever Dr. Pryce's record notation says about the quality of her work. Pryce's jaw moved. His lawyer touched his arm again. The third matter, Dre said, and opened her own folder, is the 2 closed clinical outcome reviews. She laid documents on the table. I've reviewed the underlying records and the closure authorizations. The closures were signed by Warren Schultz in his capacity as clinical oversight officer. Given the federal investigation currently active against Schultz, these closures are being reopened under Federal Health Oversight Authority. Both cases will be reviewed by an independent clinical panel. She paused. Dr. Pryce, the independent panel's scope includes your clinical decision-making in both cases. You should inform your legal counsel of this if he is not already aware. Garrett was already leaning toward Pryce, speaking quietly. Poole, at his end of the table, had the expression of a man who was doing significant internal arithmetic about what he had known, when he had known it, and what his position would look like under the light of a federal review. He was not a corrupt man, Nora thought. He was a man who had accepted explanations that were convenient and hadn't looked hard enough at what was underneath them. That was not innocence, but it was a different category. Mr. Poole, Dre said, as if she'd read the thought. I'd like to speak with you separately after this meeting about administrative protocols for future internal reviews, specifically about the independence of the review process from department chiefs with a direct interest in outcomes. Of course, Poole said, in the voice of a man accepting something he has no grounds to refuse. Nora watched all of this. She watched Pryce's face move through configurations that his lawyer couldn't stop entirely. The controlled anger, the calculation, the moment when calculation reached a conclusion he didn't like, and his expression went flat. She watched Garrett whisper something that made Pryce go very still. She had expected to feel something larger at this point. Vindication was the word people used, and it was the right word structurally, but the actual experience of it was quieter than the word implied, more like the cessation of a sound she'd been hearing for weeks without fully registering, the particular silence that followed the removal of a sustained pressure. She was not satisfied in any triumphant sense. She was correct. She had been correct throughout, and now the room understood that, and the room would proceed accordingly. That was enough. The meeting formally concluded at 8:40. People moved in different directions with the particular body language of those directions. Dre to a phone call, Merritt to whatever came next in a federal investigation, Poole to what Nora suspected was a very long morning of self-examination, Pryce and Garrett to the hallway in the focused silence of a legal strategy being urgently constructed. Hargrove found her in the corridor. "How are you?" he said. "I've been in longer meetings," she said. "That's not what I asked." She looked at him. He was in full dress uniform, and he had come to a civilian hospital in Denton, Missouri at 7 in the morning because a nurse on a floor reassignment had reset a tourniquet in a way that told him something, and he had spent the night building something that she was only now fully seeing the architecture of. "Why?" she said. "You could have filed the commendation and left it at that." "I could have," he agreed. "So why didn't you?" He was quiet for a moment, not considering the answer. He had the answer, she could see that, considering whether to say it directly. "Because I've seen what happens when someone like you, with your training, your record, comes back from a deployment and tries to disappear into a quiet version of life," he said. "Sometimes it works, and sometimes the thing they're trying to leave finds them anyway, because the thing they were running from wasn't their past. It was this." He indicated the hospital with a minimal gesture. "People being hurt by systems that should protect them, and someone with the specific skills to see it." She held this. "I wasn't running," she said. "I know," he said. "That's why I helped." He left. She stood in the corridor of the second floor of Harlow General Hospital, and around her the hospital was doing what hospitals did, moving, beeping, announcing, sustaining. And she stood still in the middle of it. Wow. At 9:15, she went to check on Doyle. He was sitting up, which was new, eating something from a tray with the expression of a man who had decided that hospital food was infinitely preferable to not being alive to eat it. He looked up when she came in. "I heard," he said. "Already." Word moves fast in military channels. He set down his fork. "Are you okay?" She pulled a chair and sat, not the efficient crouch of clinical assessment, but actually sitting, which she realized she hadn't done in what felt like a long time. "I think so," she said. "You don't sound sure." "I'm sure about the relevant parts," she said. "The rest is just processing time." He nodded. He understood that. She could see it. "They're reopening those patient reviews," he said. "Yes." "2 people." He was quiet. "That's the part that doesn't feel like a win." "No," she agreed. "It isn't." They sat with that for a moment, which was the right thing to do. Not paper it over, not reframe it into something more manageable. 2 people who had gone into a hospital and had not come out again, and a system that had been arranged to make sure nobody looked too hard at why. That part wasn't a win, and it wouldn't become one. "What happens to you now?" Doyle asked. "I go back to work," she said. "If they'll have me." "If." He gave her a look. "Seriously." "I'm technically still on reassignment." "Right, that'll hold." He picked up his fork again. "You put a chest tube in a guy on a warehouse floor last night." She looked at him sharply. He raised both hands. "I don't know anything about any warehouse. I'm speaking hypothetically about the kind of person who would do something like that." He met her eyes with the deliberate steadiness of a man who was very good at not saying the thing he was not saying. "That's the kind of person hospitals should be trying to keep." She exhaled. "Rest," she said. "Stop talking and rest." "You keep saying that to people." "People keep requiring it," she said. She left him to his breakfast. The call from Cal came at 10:20. She took it in the stairwell. "Tell me," she said. "He made it through the night," Cal said. "Sat held above 93 the whole time. Drainage slowed around 4 in the morning, which your notes said was a positive indicator." "It is," she said. "Where is he now?" "En route to a facility that doesn't require me to explain anything on this line." A pause. "Nora, he asked me to give you a message." "What message?" "He said, tell her I owe her one and I pay my debts." She leaned against the stairwell wall, closed her eyes for 3 seconds. "Tell him to focus on his recovery," she said. "He'll ignore that." "I know," she said. Tell him anyway. She hung up and stood in the stairwell and breathed. It was the first moment since she'd driven to the depot, in the rain, that she had been completely alone with nothing requiring immediate action, and the stairwell was clean and bright and smelled like industrial cleaner, and nothing was happening in it except ventilation. She was still there when the door opened and Marcus Webb came through it, clearly not expecting to find her, pulling up short and then not leaving, which was consistent with his established behavior. Hiding? He said. Thinking, she said. Same stairwell you took my call in 3 weeks ago. Good acoustics, she said. He leaned against the opposite wall. He looked tired. He'd clearly been on overnight call, but the tiredness had the quality of post-adrenaline rather than defeat. Kareem is okay, he said. In case you were wondering, Okafor talked to her this morning. She's not in any trouble for the co-signature. The position was that she was under supervisor coercion, which is, it's not a great situation, but it's survivable. Good, Nora said. Pryce has gone off the floor. Nobody's officially said anything, but he's not in the department. His cases have been redistributed. He paused. The residents are... There's a particular mood in the department right now. The kind of mood that happens when something that felt wrong for a long time gets acknowledged as actually having been wrong. Relief, she said. Yeah. Mixed with the uncomfortable part, which is that everyone has to decide what they did or didn't do when it was happening. He looked at her. What you said to Kareem about doing it because it's right and not because of the general or tonight. She told me. She told me exactly. He stopped. I didn't say anything. 3 weeks ago. I called you and told you about the chart notation, and then I didn't do anything else. You told me, she said. That was something. It wasn't enough. No, she agreed. But you know that now. He nodded slowly. She could see him sitting with it, not performing contrition, actually sitting with it, which was harder and more useful. Will you come back to the ED? He asked. That's not my decision, she said. That's Okafor's and Dre's. What do you want? She thought about this. What she wanted. It was a question she hadn't asked herself directly in a long time, because the answer had been buried under the more immediate question of what the situation required. I want to work, she said. I want to be in a room where something matters and do the thing that needs doing. That's what I've always wanted. That's it? That's enough, she said. Marcus looked at her for a long moment. Then he nodded, like something had resolved for him. Okay, he said. I'm going to go sleep for 4 hours. He pushed off the wall. Don't stay in the stairwell too long. He left. She stayed in the stairwell a few minutes more. Then she took the stairs up to the 3rd floor and found Sylvia Okafor in the nursing station reviewing charts. Sylvia looked up. The review board meets in 2 weeks, she said without preamble. For a formal determination on the record alteration and the reassignment, Dre's office will have a representative present. I'll be here, Nora said. Your current reassignment... Sylvia paused. Technically, it stands until the board convenes. However, given the circumstances, I'm exercising administrative discretion. She held Nora's gaze. If you would like to return to the emergency department today, I am authorizing that return pending formal board confirmation. Nora looked at her. Today. The department is running short, Sylvia said. Pryce's cases have been redistributed and the staff is adjusting. It's a practical consideration as well as a... She stopped. It's the right thing to do. Nora said, I'll go change into a clean set. She was almost to the elevator when her phone buzzed with a message from a number she'd now saved under Merritt's name. The message was 2 sentences. Schultz made contact with Pryce 40 minutes ago. We have the call. And then, he told Pryce there's a document, a file Pryce put together on you, but not for the licensing board. Something older. Something from your service record that he obtained through Schultz's connections and was holding in reserve. Nora stopped walking. She read the message again. A file from her service record, obtained through Schultz, who had institutional connections that had now been confirmed to include significantly more access than a clinical oversight officer should have had. A document that Pryce had been holding in reserve, not filed, not submitted, but kept. Waiting. The kind of document you kept in reserve was not the kind that showed you in an ordinary light. It was the kind that changed what people thought they knew about you. The kind that, if it surfaced in the wrong context with the wrong framing, could turn a commendation into a liability. She knew her service record. She knew what was in it. She knew what was in the parts that were classified and what was in the parts that had been partially declassified. And she knew there were things in the former category that, removed from their operational context and presented without that context, could be made to look like something other than what they were. Her phone buzzed again. Merritt. He's meeting someone in 20 minutes. Not Garrett. Someone we haven't ID'd yet. We're moving on it, but I wanted you to know, whatever's in that file, it may not stay in reserve much longer. Nora stood in the corridor of the third floor of Harlow General and understood that the thing she had believed was concluding, the machinery of exposure, the institutional reckoning that had been building since Hargrove walked into Bay 7, had not concluded at all. Pryce was not someone who accepted the ground shifting under him. He was someone who, when the ground shifted, went looking for the lever that would shift it back. And he had apparently been holding that lever since before she had even known he was watching her. She called Merritt back before she took another step. "The meeting," she said when Merritt picked up. "Where?" "We think the hotel on Clement Street, the Aldridge. Pryce checked in there last night. We assume he didn't want to go home." A pause. "Nora, we have eyes on it. You don't need to—" "What's in the file?" Nora said. "If you know." A longer pause, the kind that meant Merritt knew and was deciding how much to say. "Based on what we pulled from Schultz's communications, it's an incident report from your third deployment. An engagement in which, the way Schultz's contact described it, it was framed as an unauthorized field decision that resulted in civilian casualties." Nora stood very still. "That's not what happened," she said. "I know," Merritt said. "I've seen your actual record. The incident was reviewed and cleared by a military tribunal in 2019, but the raw report, without the tribunal outcome, without the operational context—" "It looks like something else," Nora said. "It looks like exactly what Pryce would need it to look like," Merritt said. "If it surfaces publicly before we can contextualize it, before Hargrove can get ahead of it, it changes the story. You go from decorated combat specialist to someone with a contested history. Everything from last night gets reframed. The commendation becomes complicated. Your testimony in the board review becomes contested." Nora understood this with a clarity that was almost physical, the architecture of it, the specific intelligence of choosing that particular document. It wasn't going to be enough to sink her. It was going to be enough to slow everything down, create noise, give Pryce's lawyer something to work with while the federal case took months to build. It was going to be enough to make people uncertain, and uncertainty was the environment that men like Pryce had always operated best in. "Who is he meeting?" she said. "We believe a journalist," Merritt said. "Local, Denton Courier. If the file goes to press before we can—" "What's the journalist's name?" "Nora. The name." A beat. "Petra Vanek. She covers the health beat. She's legitimate. Not a plant, just someone Pryce has apparently decided can do the most damage in the shortest time." Nora was already moving toward the elevator. "How long before your people move on the meeting?" "We can't move on it," Merritt said, with the careful frustration of someone explaining a legal constraint they personally found inconvenient. "We can surveil. We can't intercept a conversation between a private citizen and a journalist. First Amendment." "I'm not asking you to intercept it," Nora said. "I'm asking how long before your people are in position." "They're already there." "Good," she said. "Stay on the line." She took the elevator down. Back. The Aldridge Hotel on Clement Street was 8 minutes from Harlow General on foot, 4 by car. She drove, not because she was in a hurry, but because she needed to arrive thinking clearly rather than out of breath. And the 4 minutes in the car gave her the space to assemble what she was going to do. She was not going to stop the meeting. She was not going to confront Pryce in a hotel lobby. She was going to do something considerably simpler and considerably more effective, which was the approach she had applied to most things in her life that actually worked. She was going to talk to Petra Vanek first. Merritt, still on the line, said, "What are you planning?" "Journalism runs on the best version of a story," Nora said. "Right now, Vanek has one side of it. I'm going to give her the other side before Pryce gives her his." "That's—" Merritt paused. "That's not something I can officially endorse." "I'm not asking you to," Nora said. "I'm asking you to tell me what Vanek looks like." A brief silence. Then, "Late 20s, short reddish hair. She'll be in the hotel restaurant. That's where Pryce's meeting was set." "Thank you," Nora said. She pulled into the Aldridge's small parking lot. She sat for 30 seconds. She thought about the tribunal in 2019, and the 4 people who had been in the room for it, and the determination they had reached after 3 days of testimony, and the way that determination had been filed into a classified record that was accurate and complete, and which Roland Pryce was now trying to use the absence of to build a different story entirely. She thought about the 2 patients in those closed reviews. She thought about Doyle eating breakfast. She thought about Reeves on the concrete floor of the depot, breathing in the specific shallow way of someone whose body was fighting something their mind was trying to stay ahead of. She got out of the car. The hotel restaurant was the kind of space that aspired to quiet elegance and achieved instead a kind of inoffensive functionality. Round tables, low lighting for the morning hour, a breakfast service with cloth napkins that were slightly too formal for the scrambled eggs they accompanied. There were maybe a dozen people in it. Pryce was not there yet. She clocked this immediately and understood that she had a window, probably small. Petra Vanek was at a corner table with a coffee and a notebook, actual paper, which Nora noted with something close to respect. She was young, looked younger than late 20s, with the alert and slightly hungry look of a reporter who was working on something she believed was real. Nora went to her table and sat down across from her without being invited. Vanek looked up sharply. "I'm waiting for—" "I know who you're waiting for," Nora said. "I'm the other half of his story, and I have about 10 minutes before he gets here, so I'd like to use them." Vanek looked at her, the hungry, alert look recalibrated. "Who are you?" "Nora Voss. I'm the nurse he's been trying to remove from Harlow General for the past 9 weeks." She set her phone on the table, screen up, showing the tribunal determination from 2019, which she had pulled up in the car. "He's going to show you a document, a raw incident report from my 3rd military deployment. Before he does, I want you to see what the investigation of that incident actually concluded." Vanek looked at the phone, looked at Nora. "How do you know what he's going to show me?" "Because it's the only thing he has left," Nora said. "Everything else has been addressed in a federal oversight meeting that happened this morning at Harlow General. The record alteration, the closed patient reviews, his financial relationship with Warren Schultz, all of it is now on federal record." She held the reporter's gaze. "What he's bringing you is a document that looks damaging if you don't know what comes after it. I'm showing you what comes after it." Vanek picked up the phone. She read. She was fast. Good reader, scanning rather than consuming, hitting the relevant sections. Her expression moved through several configurations. "This is a military tribunal outcome," she said. "Clearing me completely of any wrongdoing in that incident," Nora said, "which the incident report alone does not show. He's going to give you the report. He's not going to give you this." "Why not?" "Because this document makes his document useless," Nora said. "And Roland Pryce has been in this situation long enough to understand that useless is exactly what his document is. He's hoping you don't know enough to ask." Vanek set the phone down. She looked at Nora with the directness of someone who had decided something. "Are you willing to go on record? Full interview. Everything from the past 9 weeks." "Yes," Nora said, "including the federal investigation. To the extent that Agent Merritt of the FBI's Organized Crime Division is willing to confirm what I say, yes." She paused. "You can call her. I have her number." Vanek stared at her. "You came in here with an FBI contact number." "I came in here with what I needed," Nora said. "That's generally how I operate." The restaurant door opened. Roland Pryce came in, and he saw Nora at Petra Vanek's table, and his face did something that she had never seen from him before. Not anger, not calculation, but the specific expression of a man who has made a move in a game and arrived at the board to find that the game has already ended. He stood in the doorway for 3 full seconds. Then his lawyer, Garrett, who was behind him, said something quietly and touched his elbow, and Pryce turned around and they left. Vanek watched the door. "Was that him?" "Yes," Nora said. "He just left." "Yes," Nora said. Vanek looked at her notepad, picked up her pen. "Start from the beginning," she said. The interview took an hour and 20 minutes, and Nora told it straight. No performance, no careful construction of a flattering narrative, just the sequence of events as they had happened, including the parts that made her look uncertain or slow, or like someone who had made choices that were defensible but not perfect. She told Vanek about the 9 weeks of supply runs, and the pediatric waiting room, and the way she had let herself be erased from the trauma floor because she had believed, with the kind of faith that came from experience, that the right moment would come. She told her about Pryce and the chart notation and the reassignment and the conference room in Hargrove saying, "Where did you learn those procedures?" and the look on the corridor staff's faces when the answer to that question had been significantly larger than anyone had expected. She told her about the licensing flag and Schultz and the 2 closed reviews and the names of the 2 patients, because she thought the 2 patients deserved to be named in print, in a newspaper, where someone who had loved them might read it and understand that what happened to them had not been invisible. She did not tell Vanek about the depot, or the rail yard, or Aaron Reeves, or Cal Rutherford, or anything that belonged to a world that was not this one. She had drawn that line clearly in her own head, and she held it cleanly. When she was done, Vanek sat back and looked at her notebook, which was full. "Why nursing?" she said, "after all of that?" It was the same question Marcus had asked, and Nora gave a version of the same answer, but not the same answer, because the version she gave Marcus had been true for that moment, and this one was true for this moment. "Because I was tired of being the person who decided," she said. "I wanted to be the person who did. There's a difference. Not everyone finds it meaningful, but for me it was, I wanted to be in the room with my hands on the actual problem, not managing the room, in it." Vanek wrote this down. "And now?" "Now," Nora said, "I think I'm going to be in the room for a long time." She meant Harlow General. She meant the emergency department and the supply carts and the patients who were scared and the residents who were making decisions under pressure and all the small, unglamorous, necessary work of keeping people alive in a building where people came when things went wrong. She meant all of it, including the difficult parts, including the days when it cost more than it returned. She meant it the way she had always meant the things she committed to, completely, without a reservation held in the back of her hand. Vanek looked at her for a moment. "I'm going to call Agent Merritt," she said, "and then I'm going to call Hargrove's office, and then I'm going to write this." "I know," Nora said. She stood. "Be accurate." "That's my job," Vanek said. "I know," Nora said. "I'm saying it anyway." She left the restaurant and walked into the Denton morning, which was clear after the rain, the sky the particular blue that follows a night of weather, and the air smelled clean in the way that scrubbed air did. Not sweet, not performed, just clean. All the previous day's weight washed off it. She drove back to Harlow General. The Denton Courier story ran online at 4:17 that afternoon under Petra Vanek's byline, with the headline, "Decorated Combat Veteran." Working as floor nurse exposes years of fraud at Harlow General Hospital. It was thorough and it was accurate, and it named Warren Schultz and Roland Pryce and the 2 patients from the closed reviews, and it included a quote from Agent Merritt confirming an active federal investigation, and a quote from General Hargrove's office confirming the military commendation, and a quote from Nora that was 3 sentences and said exactly what she had meant it to say. By 5 o'clock, the story had been picked up by the regional Associated Press wire. By 6, 2 national outlets had requested comment from Harlow General's administrative office. By 7, Warren Schultz had retained criminal defense counsel and issued a statement through that counsel declining to comment on any pending investigation, which was the statement of a man who had run out of procedural moves and was now in the territory of legal consequences. Roland Pryce did not issue a statement. His lawyer issued one on his behalf, using language so careful and so drained of specific content that it communicated, in its very emptiness, the thing it was trying not to say. Nora was in the emergency department when the story went live. She was managing a post-op patient who had been discharged too early from a surgical floor and had arrived in the ED with a wound, dehiscence, and a blood pressure that needed attention. She was focused on the wound when Marcus came to the bay door and said her name with a particular quality of voice that made her look up. "The story's up," he said. "I know," she said. "Hand me the irrigation syringe." He handed her the irrigation syringe. She irrigated the wound. She assessed the tissue margins. She called for a surgical consult and dressed the wound in the interim and documented everything in sequence. When the patient was stable and the consult was on its way up, she stepped out of the bay and read the story on her phone, standing in the corridor of the emergency department of Harlow General Hospital in Denton, Missouri, at 4:37 in the afternoon. She read it once, carefully, the way she read everything that mattered. It was accurate. Every fact she could verify, she verified in her head as she moved through it, and every fact held. She put the phone in her pocket. Deborah Finch was at the nurse's station, watching her. Deborah had been watching her, Nora realized, with varying degrees of intensity since the story broke, with the particular attention of someone who was doing the slow, uncomfortable work of revising a long-held assessment. Deborah was not a woman who revised easily. She was also not a woman who refused to revise when the evidence required it, which was ultimately the more important quality. Bay 3 needs eyes, Deborah said. Chest pain, 62-year-old, rule out ACS. On it, Nora said. She went to Bay 3. She did the work. The 62-year-old was a man named Harold, who was frightened in the specific way of people who know that their body has done something unfamiliar and cannot determine how serious it is. And she talked to him while she worked, not to fill space, but because he needed to hear a voice that was not alarmed, and she was not alarmed, and she could let him feel that clearly. His workup came back consistent with unstable angina, serious but manageable. She explained this to him in language that was plain and honest, not sugar-coated, not catastrophized, just what was true and what the next steps were and why. He asked her 3 questions and she answered all 3 directly. When the cardiologist came, Harold looked at Nora and said, "Will you still be here, after?" "I'll be here," she said. She meant it as a practical statement. She said it and understood in the saying of it that it was also something more than practical. It was the answer to a question she had been carrying around for longer than 9 weeks in Denton. Longer than the deployment, longer than the tribunal, longer than the nursing degree, and the deliberate choice of a quiet corner of the country where nobody knew her name in the way it had once been known. She had been asking herself, in one form or another, since 2021, whether there was a version of her life in which she got to just be the person in the room with her hands on the actual problem, without the weight of everything that had shaped her arriving first and rearranging the room before she could get to the problem. The answer, it turned out, was no. That was not how it worked. You did not get to separate what you were from what you'd been. The 10 years of deployment were in her hands when she reset a tourniquet. The tribunal was in her posture when she walked into a room where someone was trying to make her smaller. The choice to leave was in her stillness when she could have performed something easier. The weight was not the enemy. The weight was the whole point. She was still figuring that out. She suspected she would be figuring it out for a long time. But the direction of it was clear now in a way it hadn't been before. Not because the story had run, or because Pryce was facing consequences, or because Hargrove had come with dress uniforms and federal oversight directors. Those things mattered, but they were not the source. The source was the moment in Bay 7 when a young soldier had looked at her with the fundamental question in his eyes, and she had met it without flinching. She had been that person for as long as she'd been alive. The 9 weeks of supply runs and pediatric waiting rooms had not changed it. Pryce's reassignment letter had not changed it. The depot and the concrete floor and the chest tube had not created it. It had always been there. It just needed the right conditions to become undeniable. The formal review board met 12 days later, as scheduled. The hearing took 4 hours. Sylvia Okafor presented the administrative record. Asha Karim gave her account in a voice that shook once, near the beginning, and then steadied and stayed steady for the remaining 40 minutes. Merritt's office submitted a written statement confirming the federal investigation and the relationship between Schultz and Pryce. Hargrove's formal commendation was entered into the record. Nora gave her account last. She sat at the end of the conference table, a different configuration than the first time, the table no longer feeling too large but simply functional. And she told the board what had happened in Bay 4 3 weeks ago, and what had happened in the emergency department the night the soldiers came, and what she had understood about the environment she had been working in. She was not angry in the telling. She was precise. Precision was the thing she had always trusted more than any other quality of expression, because it left the facts standing on their own without requiring her emotion to hold them up. The board deliberated for an hour and 40 minutes. The determination was complete exoneration on every count. The chart alteration was formally documented as Pryce's responsibility, and the supplemental notation was flagged for permanent correction in the patient's record. The reassignment was ruled procedurally improper and struck from Nora's personnel file. The licensing flag, already voided by Schultz's suspension, was formally expunged. The board chair, a woman named Dr. Iris Tam, whom Nora had never met before, looked at her over the table when the determination was read and said, in a voice that was even and direct, On behalf of this institution and this review process, I want to acknowledge that what happened to you in this hospital was wrong. Not just procedurally wrong, wrong. Nora held her gaze. Thank you, she said. Is there anything you need from us? Dr. Tam said, to feel that the record reflects what actually occurred. The record is correct now, Nora said. That's what I needed. Roland Pryce's hospital privileges were formally suspended pending the outcome of the federal investigation, which was now targeting both him and Warren Schultz under healthcare fraud statutes that carried significant criminal exposure. Garrett continued to represent him and continued to issue carefully worded non-statements. The 2 closed patient reviews were reopened by the independent clinical panel Dre had ordered, and the preliminary findings, released 6 weeks later, characterized both as deaths in which the standard of care had been materially compromised. Those findings were not a trial. They were not a conviction. They were a formal acknowledgement that 2 people had been failed by a system that should have protected them, and that the failure had been seen and named and documented. It was not justice in the complete sense. It was the beginning of accountability, which was what justice looked like in institutional settings. Not a single dramatic moment, but a series of documented truths accumulating until the structure that had supported the wrong thing could no longer hold its weight. Gerald Poole did not lose his position. He was required to complete an administrative training program on independent review processes and conflict of interest protocols, and he submitted to a reorganization of the hospital's internal oversight structure that removed department chiefs from any review process in which they had a clinical stake. He accepted this without public complaint, which was the behavior of a man who understood what he had failed to see and was choosing to address it rather than minimize it. Nora thought this was probably the right outcome for him. Accountability did not require identical consequences for identical failures. It required proportional ones. 3 months after the night the soldiers came, Harlow General opened a pilot program under the Emergency Department's Continuing Education Office. It was not large, 4 sessions per year, 20 participants per session, combining tactical trauma protocols with emergency nursing applications. The curriculum had been developed by Nora over 6 weeks, in the hours after her shifts, at the break room table with the bad microwave and the parking structure view. She taught the first session herself. The participants were nurses, primarily, with 4 residents attending as electives. They were at varying levels of experience, some with a decade in trauma bays, some with less than 2 years. They came into the first session with the particular wariness of people who had been told they were going to learn something and weren't yet certain whether that was going to mean they were going to be taught at or taught with. She opened the session without slides. She pulled a tourniquet from a bag and put it on the table and looked at them. The difference between a tourniquet applied in a classroom and a tourniquet applied under pressure is not technique, she said. It's the 5 seconds before the technique. What happens in those 5 seconds determines whether the technique works. She looked at the room. We're going to spend today on the 5 seconds. The technique you already have. One of the experienced nurses, a man named Porter, who had been in the ED for 11 years and had the look of someone who had decided before walking in that this was probably going to be remedial, sat up slightly. What's in the 5 seconds? He asked. The decision, she said, whether to move or freeze, whether to trust what you know or wait for someone else to confirm it, whether the thing in front of you is worth more than the risk of being wrong. She picked up the tourniquet. We're going to practice making that decision until you stop having to make it, until it's just what you do. Porter looked at her for a moment. Then he nodded, in the way that people nodded when something had landed where they hadn't expected it. She worked through the session with the same economy she applied to everything. No wasted motion, no performed enthusiasm, just the steady and specific work of teaching people to be present in hard moments. She corrected errors without commentary. She asked questions that forced participants to explain their reasoning rather than just execute a procedure. When someone got it right, she told them why it was right rather than simply that it was. At the end, one of the residents, a first-year named Torres, who had been the most openly skeptical at the start of the session, came to her at the table. Can I ask you something? Torres said. Yes. How do you stay calm when everything's going wrong? I've seen people who say they're calm and they're clearly not, and then I see, Torres gestured vaguely. I've seen you work. You're actually calm. How does that work? Nora thought about this. She thought about what the true answer was, rather than the useful-sounding one. I'm not calm, she said. I'm organized. There's a difference. When things go wrong, I stop feeling calm and I start moving through what I know, in sequence. The feeling and the action separate. The action doesn't wait for the feeling to settle. She looked at Torres. You can't teach yourself to feel calm in a crisis. You can teach yourself to act correctly while the feeling does whatever it's going to do. Torres absorbed this. That takes a long time. Yes, she said. It does. Did something happen that taught you that? She picked up the tourniquet and put it back in the bag. She thought about a ditch in a place she didn't name. She thought about a concrete depot floor and a man named Reeves. She thought about a Bay 4 with a patient whose oxygen sat was at 78 and falling. Many things, she said, over a long time, in that order. Torres nodded slowly. Okay, they said. Okay. They left. She put the rest of the materials in the bag and sat at the table for a minute, alone in the training room with the kind of quiet that followed a session done well. Not silence exactly, but the particular stillness of a space that had been used for something real. Her phone showed a message from Cal. He's walking. 12 weeks ahead of schedule. Says to tell you he knows. She looked at this for a moment. She typed back, tell him good. She put the phone away. She thought about what Torres had asked. Did something happen that taught you that? The honest answer was that everything had. The deployments and the tribunal and the decision to leave and the choice of Denton and the supply runs and the erasure and the night and the rain. The way that Hargrove had walked into Bay 7 and looked at her with the eyes of someone who had already done the recognition and was simply waiting for the rest of the world to catch up. The way that Asha Karim's hands had shaken and then steadied. The way that Doyle had said I knew it with something close to satisfaction. The way that Reeves had said okay and meant it on a concrete floor, in the dark, to a stranger who was asking him to trust her with his life. None of it had been clean. None of it had gone exactly the way it might have gone if the people involved had made better decisions at earlier moments. There were 2 dead patients who deserved different outcomes, and a man with a bullet scar who had been lucky in ways that depended partly on factors outside anyone's control, and a resident who would spend the rest of her career remembering the choice she'd made when a supervisor told her to sign a document she hadn't fully read. The world that produced Nora Voss had not been a world of clean outcomes. It had been a world of hard decisions made in bad conditions by imperfect people trying to do the right thing, and sometimes getting it right and sometimes not. And the sum of those decisions had made her exactly who she was, which was someone who moved toward the hardest thing in the room, not because she was fearless, but because she had learned in a long sequence of hard rooms that the hardest thing in the room was always the thing that most needed someone to move toward it. She picked up her bag. She walked out of the training room, into the corridor, into the ordinary living motion of Harlow General Hospital on a Thursday afternoon. The overhead pager, the meal cart, the automated doors, the particular smell of a place that was doing the ongoing and unglamorous and completely essential work of keeping people alive. She took the stairs to the emergency department. Deborah Finch was at the triage board. She looked up when Nora came through the door, and her expression had changed in the way that things change when a significant period of time has passed since the last time you looked. Not a different expression exactly, but the same features arranged around a different internal calculation. Busy? Nora asked. When isn't it? Deborah said. She looked at the board. Bay 2 needs an assessment. 40-year-old abdominal pain came in 15 minutes ago. Vitals are stable, but she looks wrong. I'll take it, Nora said. I know you will, Deborah said. It was the smallest thing. It was the kind of sentence that happened 100 times a day in an emergency department between people who did the work and people who needed the work done. And it meant nothing in itself and everything in context. I know you will. The acknowledgement of a person who had been seen, finally, completely, without the fog of assumption that had preceded it. Nora didn't make anything of it. She didn't let herself rest in it, or inflate it, or treat it as the ending of something rather than the ordinary continuation of the work. She just took it for what it was. A true statement, from a woman who didn't say things she didn't mean, about a person who had finally become visible in the full shape of what she was. She went to Bay 2. She introduced herself to the patient, a woman named Margaret, 41 years old, with pain on her hands from a project she'd been in the middle of when the pain started, who was trying not to let her fear show and showing it anyway, the way that people always did when they were in a place that meant something was wrong. I'm Nora, she said. Tell me what's happening. And Margaret told her, and she listened, and she moved through what she knew in the sequence that she trusted, and the action did what it always did. It separated cleanly from the feeling and went where it needed to go. Outside, Denton continued its ordinary business of being a mid-sized city in Missouri on a Thursday afternoon. People drove and worked and argued and made decisions that seemed small and sometimes weren't, and the world moved at its usual pace, indifferent to the specific reversals that had taken place in one hospital's second-floor conference room, or a hotel restaurant on Clement Street, or a concrete depot floor in the rain. But inside Bay 2 of Harlow General's emergency department, a woman with paint on her hands was being cared for by someone who had learned, in the hardest possible classrooms, that the most important thing you could do in a room full of need was to see the person in front of you clearly, not the version of them that fear had made, not the diagnosis in progress, but the actual human being who had walked in because something had gone wrong and they needed someone who knew what to do. Nora knew what to do. She had always known. The only thing that had ever been missing was a room large enough to hold what she actually was. And now she had it, not because someone had given it to her, but because she had stood in the middle of every attempt to make her smaller, and had refused, without drama, without announcement, without ever once needing the room to know her name before she walked into it, to be made small. Some people spent their whole lives waiting to be seen. Nora Voss had spent hers making sure that when the moment came, she was exactly who she'd always been. That was enough.